Eric Hammer here, registered physiotherapist, and today I'd like to talk to you about the importance of a really great subjective history. And in this, I wanted to start a series for other physiotherapists, newer grad physiotherapists, in order to provide perhaps some advice and some knowledge as a veteran in the healthcare field. But before I continue, please hit that subscribe button below so you'll be notified about any new videos that I have here on my channel. So I wanted to talk about this subject because I think it's really important both for physiotherapists in general, but also for patients, just to get an idea of how sort of providing certain information can be really helpful in terms of identifying clinically what concerns, what structural issues might be going on with a particular problem. And so what I've found in this profession is that when we're gathering information about somebody's pain, discomfort, this can be extremely valuable in terms of coming up with not only our clinical diagnosis, right, what we think might be occurring, but also the treatment plan moving forward. And I found that in getting a really in-depth subjective history, it can really guide us as physiotherapists in order to provide the best treatment possible. And so some of the things I really wanted to highlight as a physiotherapist is number one, if there's a mechanism of injury, right? So this idea of, is there been some sort of trauma that's been involved, or has this just sort of more or less come out of the blue? And in a lot of cases, this can really help in terms of identifying, specific structures which might be involved. And then the other thing I really wanted to take note of is the idea about activities that aggravate and activities that ease some patients' symptoms. So in a lot of cases, right, when we're trying to identify just our rehab process and what sort of exercises we're going to implement for a patient, as well as what structures might be involved in terms of a patient's pain, those specific positions, movements, activities that provoke, that aggravate, I've really found in my experience as a physiotherapist that getting a very in-depth, right, view in terms of, hey, when I go into this position, it consistently creates pain or discomfort, or it brings on my numbness. When I do this, I find I get the same symptoms. But when I change positions, hey, this feels better. I've found that really trying to probe in terms of these specific positions that aggravate and ease has really gone a long way in terms of creating a clinical picture for myself prior to even doing any sort of objective exam where you might get the patient to move, to check out strength. I found earlier on in my career I would not spend or get sort of in the same depth in terms of the subjective history as I do now. And I've really found that it's really important to get clear in terms of these aspects, the aggravating activities. So for example, with the shoulder, is it painful at a certain angle, a certain range? Is it painful when I bring my hand behind back? What are those specific activities as I'm repeating them that consistently brings on the pain? As well as, hey, when I'm in pain, what's my go-to, right? What's my go-to position to actually ease it? Do I feel better at rest? Do I feel as though I want to extend my arms back and that's a better position? So again, I really wanted to emphasize in this video just the importance to really get a clear picture and ask lots of questions and inquiry regarding what specific positions, movements, activities create the pain, what eases it, and get a really clear picture around the subjective history of the patient prior to doing any sort of objective exam. Really wanted to emphasize that. Then as a patient, I think it's really important to go in with the mindset of, I'm going to place sort of detective work with myself in terms of maybe keeping a notepad, a journal, and really paying attention prior to, especially that initial consultation or any, follow-up sessions, just those specific activities, those movements, those positions in which, when I go into this, it consistently brings up that same sort of pain, ache, numbness, tingling, whatever the symptom might be, and really try your best to become very curious around those aspects. And then, hey, when it comes on, when my pain level raises up, what do I naturally like to go into? What positions feel best for me? And I think what you'll find is that that sort of clarity really helps in terms of providing the practitioner, right, the physiotherapist, with a clear idea of what might be going on, so that they can really get an understanding of the clinical diagnosis moving forward, so that you can really get the treatment that is appropriate for you as quickly as possible. Thanks again for watching my video. If you have any questions, concerns, feel free to leave a comment below. And please, again, check with a doctor or physiotherapist to make sure this or any information is appropriate for you. Thanks again for watching, and have a great day. Take care.